Hi, everyone. Welcome to our session for managing disaster and pandemic response in Smartsheet. In this session, we'll cover how to use Smartsheet to respond to the unexpected. If you have any questions along the way, don't worry. Our Smartsheet team is standing by and ready to help. Just go ahead and put them into the chat window. Here we have our legal slide. This session does contain forward-looking statements, and trademarks are not endorsements. I'm Tanya Lingle, and I've been with Smartsheet for about 3.5 years, and I've been primarily working with our government customers. Every day, I am inspired by the stories I hear from you. This year has been a year like no other. Many of you have been tasked with responding to a pandemic. You are superheroes, and I can't thank you enough for the work that you're doing. For the last few years, I've been working with the state of Oregon and the Oregon Health Authority. They use Smartsheet for many, many different use cases. One of the reasons they have been so successful is because of their Smartsheet champion, Joey Rosano. Joey has done so much to enable all of her Smartsheet users, as well as inspire them. I couldn't be more honored to be speaking today with Joey Rosano. She'll be sharing their story of how they use Smartsheet for their COVID-19 response.
Thanks, Tanya, for that great introduction. I'm happy to be here, but we have a lot to cover, so let's jump right in. On the next slide. The Public Health Division is part of a larger agency called the Oregon Health Authority. We work in partnership with other divisions such as External Relations, Health Policy and Analytics, the Office of Equity and Inclusion, the Oregon State Hospital, and more. Together, we all work toward fulfilling the vision of a healthy Oregon by ensuring that all people and communities can achieve the optimum physical, mental, and social well-being through partnerships, prevention, and access to quality, affordable healthcare. We serve the entire state as part of a decentralized public health system with the state division location in Portland, Oregon, with local public health authorities throughout the state. Our Smartsheet journey began in 2016. The Public Health Performance System was created and managed in multiple Microsoft Excel spreadsheets, with many users across the division submitting monthly spreadsheets to me. As the accountability coordinator, my role was to combine and reconcile 21 different spreadsheets to produce the reports for the executive leadership team. I set aside 3 full days at the end of every month to produce these reports. My supervisor told me, you have got to find something better. So I researched several software platforms that would meet our needs. Our immunization program was already using Smartsheet for grant management, so I had a chance to test it out during my investigation. When comparing performance management software side by side, Smartsheet provided the most flexibility at the best cost, so we purchased just 3 licenses. Once I imported the Excel spreadsheets and linked them to the reports, my entire processing time went from those 3 days to 4 hours from start to finish, and improved the accuracy as well. We wanted to make sure this wasn't a fluke, so we ran a pilot test where one of our centers would use Smartsheet for the performance system reporting for 3 months, and the other 3 centers would use the old Excel version. Within 1 month, the other centers asked to be switched over to Smartsheet. And that led to a more widespread adoption in the division. Performing a cost-benefit analysis in time savings for all involved, it quickly paid for itself. Calculating all the time and effort of leadership was a cost savings of over $25,000. Since then, it's been rapidly adopted at the Public Health Division for a multitude of applications, including those listed on this slide. My role has been facilitating the use of Smartsheet throughout the division in its application toward other purposes that meet the needs of the Public Health Division, such as, a pandemic. Assembling the COVID-19 response. Like many public health divisions across the country, Oregon is in an unprecedented situation, which requires flexibility and the capacity to respond to a rapidly changing landscape with many uncertainties. When the incident management team was created in January 2020, earlier this year, to respond, Smartsheet was identified as one of the tools that could assist us in this response. Among the needs identified, we needed a platform that would allow a high degree of coordination among a variety of partners. This next screenshot is very colorful. So I'll have Tanya move over to the next one. You can see this is a basic sheet. This colorful screenshot shows our COVID-19 Health Information Center Communications Product Tracker sheet. Wow, that's a mouthful. So from now on, I'll refer to it as the HIC tracker. It gives you an idea of the incredible amount of detail and collaboration among multiple partners and subject matter experts. Each line represents one piece of communication guidance being produced. The project manager can quickly see the status of each product and where it is in the process of being produced and/or translated into 11 different languages, with the most accurate and up-to-date information surrounding the COVID-19 guidance that the Public Health Division is offering. It utilizes update requests and approval workflows while informing reports and dashboards needed to track the enormous workload and document production. When the HIC finalizes one of these documents, it goes on to our COVID Recovery and Response Unit, or CREW unit, where the fulfillment of orders is handled through the Publications Department. This is just one of the examples of how Smartsheet is being used at PHD. Let's move on to the next one. The Oregon Health Authority recognizes the impact that longstanding health inequities are having on COVID-19 in Oregon. We could not effectively address this pandemic without partners. And community-based organizations, or CBOs, are key to preventing and mitigating COVID-19 in communities that are most impacted. The newly created Community Engagement Team in the Director's Office of the Public Health Division consists of 18 Community Engagement Coordinators, or CECs, and other staff who need to be able to coordinate internally and externally with close to 200 CBOs and 34 local public health authorities. This screenshot shows a map which shows the regions that each CEC will cover, with colors being assigned regions and lines designating the counties where the local public health authorities reside. Building this support system has been likened to building the airplane while we fly it. During the initial stages of managing the grant application and award process, Public Health used multiple Excel spreadsheets once again. Keeping all the files up to date was problematic at best. I was asked if Smartsheet could provide a coordinated system that increased the response capacity while providing customized reporting and coordination among all the stakeholders involved. Let's see what that looks like. This screenshot shows the dashboard for each regional community engagement coordinator. It has a place for case notes, a few forms, some filtered lists, and contact information that's relevant to their region, including links to each of the CBOs and LPHAs they work with. They can filter the report widget to find which CBOs provide which kind of services quickly. Remember those publications offered by the CREW? Each CBO dashboard allows them to order the publications in the language they need using the Smartsheet order form embedded in their dashboard. The form goes directly to the COVID Recovery and Response Unit, and it's fulfilled by the Publications Department. Additionally, a separate dashboard for the local public health authorities has been created so they can see which CBOs and services are available in their region or county. All of these related dashboards and reports are linked and driven by one master sheet controlled by the community engagement team to maintain one contact list. Smartsheet gave us the ability to create a platform that brings together stakeholders and partners across the state. However, increasing our user base so quickly was not without growing pains. On the next slide, we'll tell you about Smartsheet sessions. For the first time, Public Health purchased access to the Center of Excellence for Smartsheet training for all licensed staff. However, due to COVID-19, staff have not been accessing it as much as we had hoped. To help the staff in the moment, Public Health established a community of practice for Smartsheet users offered every other week for 30 minutes, called Smartsheet sessions. During these sessions, licensed users learn how to go beyond the sheet, first showing basic features such as data collection and workflow approvals, and then making the transition from just a sheet to creating reports and dashboards, which seem to be where Smartsheet as a platform really shines. Members of the community of practice regularly provide positive feedback on the value of shared learning. The group is a great place for professional show and tell. In closing, I always say that even though the Smartsheet looks like Excel, it's really more like an Access database combined with SurveyMonkey, Outlook, Excel, Microsoft Project, all rolled up into one. Once users understand that functionality, you can start to see the possibilities of applications, and you're really only limited by your imagination. Some users build initial sheets closer to Excel structures than database structures, and they get frustrated. But having the Smartsheet sessions allow users to understand the importance of system design and permissions, which is really important. That said, we've been able to utilize Smartsheet in both short-term and long-term projects, including the response to COVID-19 and the support system we're building to reinforce that. The silver lining is we're able to maintain these systems and the rapid changes from day to day in our virtual environment and still acting like a well-oiled machine. I can honestly say that increasing the product knowledge within the division has had an immediate return on investment in time, accuracy, and capacity. It's been my pleasure showing you this, and I know Tanya has more great resources to show you.
Wow, thanks so much, Joey, and thank you to everyone at the Oregon Health Authority and all of you out there that have been working hard to keep all of us safe. If you're inspired by Joey's story as much as I am, please attend our other public sector sessions or share your story with us and go to our government community page. I know that you've got an interesting story that we would love to hear. Thank you so much.